Diabetes makes having a healthy smile a challenge, but dentistry has changed. Dr. Charles Martin is here this morning. You know, whenever you come in, I learn something each time you come in.
Good.
And I know this is an area with dentistry and diabetes that you're very interested in,
right,
and specialize in, and even you're working on a book.
Yeah, I have a book called Don't Sugarcoat It, which will be published shortly.
All right, we'll keep an eye out for that.
Yeah, right.
Well, let's talk about this. 81 million people have something working inside of them that's a secret enemy.
That's right. They don't even know they got it.
Yeah.
And that secret enemy is, well, first of all, it is dentistry. It's gum problems. It's infections in their mouth. Who are these 81 million people? It's diabetics and pre-diabetics who don't, and of course, the number of diabetics, the number of pre-diabetics are greatly different. There's 21 million known diabetics, 7 million undiagnosed diabetics. Typically, it takes 7 years to find someone actually to get the diagnosis of being diabetic. But there's 54 million pre-diabetics. That's according to the American Diabetes Association. So,
and these numbers are really ballooning now,
right?
Across the country, and obviously, as I said, this is an area you're very interested in.
Right.
So more and more people all the time are going to be facing this problem.
Right. Well, the thing that they can't neglect, and which they will if someone doesn't tell them, I'm trying to get this message across, is that if you can't ignore your teeth during this process, because if you do, it makes your blood glucose level more difficult to control.
Are we talking brushing, flossing, dentist?
We're talking about
getting
your teeth fixed, getting your gums fixed, keeping your mouth in good health.
Okay.
Because as a diabetic, you know, it's a chronic progressive disease that breaks people down. Even as a pre-diabetic, meaning I'm not quite there, well, it's not an off and on switch. So if you're pre-diabetic, you're more predisposed to having problems. How big a deal is it? Well, if you're a diabetic and you have periodontal disease, your mortality rate increases by eight times.
Wow. And when we go to the dentist, is he going to see these kind of, are there some clues that he'll be able to see?
Well, you know, you are more likely, by the way, it also goes the other direction. If you're diabetic, you're more likely to have dental problems. You're more likely to have gum problems, more likely to have tooth decay. How much more? Somewhere between 200 and 400% more likely to have gum disease. Ugly.
So there's a clue right there.
Right, there's a clue right there. Yeah. So so now part of what we do is we're helping to screen for this in our offices, and I lead a group nationwide that helps take care of this problem called Dentistry for Diabetics. So we're always looking at our patient base, seeing what's going on with individuals. Are they likely to be in this situation?
Watching out for them.
Absolutely.
All right. Well, you always bring us before and after, and
right.
I'm going to watch that now real quick and see the difference here. Tell us about this.
This lady had a difficult time with her teeth for quite some time, and was really tired of dealing with issues that wouldn't get fixed and stay fixed. And if there's one complaint I hear from patients is, you know, Doc, I want it to stay fixed. I don't mind getting it fixed, but make it stay fixed. Yeah. So this is what we're able to do for this lady, and she had a problem that we've managed to improve her smile power and get her healthy at the same time.
Very good. Good information.